Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. There are regular briefings given twice a day, one at 11 a.m. and another at 2 p.m. by the Central Disease Control Headquarters. South Korea has confirmed 96 new cases on Saturday morning, which brings the total number of confirmed cases to 10,156. With 3 additional deaths, the death toll has now reached 177. Over 6,300 people have fully recovered and been sent home. And South Korea's nationwide social distancing measures are likely to be extended, originally scheduled to end this Sunday. During a briefing on Saturday, South Korea's Prime Minister Chung Se-kyun highlighted that strong social distancing has to continue. Chung said that the measures are likely to be extended as the number of imported cases continues to rise and it's not yet safe to send children to school. But the Prime Minister noted that the situation is under control compared to that of the U.S. and Europe. Korea has fewer cases of untraceable transmission sources or mass infections from health facilities. Specific measures on how to practice social distancing are to be announced in the upcoming briefings. And to halt the spread of the coronavirus, South Korea is implementing more severe penalties for those violating the country's self-quarantine measures starting this Sunday. Currently, people breaking quarantine can be fined up to $2,400, but from Sunday, the penalty will be increased to a maximum fine of $8,100 or a prison term of up to 100. According to the Central Disease and Safety Countermeasure Headquarters, the police have received a total of 52 cases of self-quarantine violations as of Wednesday, with 6 cases so far being passed on to the prosecution. The briefing is now starting, so let's take a listen.
We have 94 more patients from yesterday, and the total number of confirmed cases stands at 10,156. And of them, 6,325 have been discharged following full recovery. Up until now, we had 688 imported cases from overseas, and of them, 91% are Korean nationals. And the foreign nationals account to about 8.2%, which are 57. And the death toll stands at 177. And we have conducted about 450,000 screenings of the COVID-19 testings. I send my deepest condolences to those who have passed away, as well as the members of the bereaved families. Yesterday in Gyeongbuk, in Gyeongsan City, a doctor has been infected by the COVID-19, and he has passed away yesterday. And this doctor has seen that amid the increase of the outbreak of the COVID-19 in the region, he has stood at the forefront of fighting against the virus by treating those who are on self-quarantine. The government sends its deepest condolences, as well as the members of the bereaved families. And even at this very moment, there are many medical practitioners who are battling on the front lines, and we extend our deepest gratitude to all of them. And I ask the public to also send your words of encouragement and support to all of them. Today, the government has convened a KCDC meeting this morning under the Prime Minister Chung Se-kyun, and we touched upon issues of intensifying our social distancing going forward, and we also touched upon issues of financial subsidies for the SMEs. And Prime Minister Chung has highlighted the fact that after practicing enhanced social distancing measures, we have been able to control the outbreak compared to countries like Europe and the U.S. He also extended his gratitude to all of the public for their participation. However, seeing an increase in the number of imported cases, as well as a surge in the outbreak of the global pandemic, he said that we need to continue to practice enhanced social distancing for the time being, for the sake of the safety of our communities. And throughout the past 2 weeks, our society has practiced enhanced social distancing measures. And many of the public have refrained from going outside and going to gatherings despite all the difficulties. And if we did not practice the social distancing, there were cases that could have led to a wide spread of infections. And at the Bucheon 생명수 Church, there was a case that has worked at the daycare center, but the daycare center was on temporary closure, so we were able to prevent a widespread cluster. And also at the Manmin Church at Gurogu District and Seoul, the fact that they transformed their service to online live streams, they were able to decrease the widespread cluster infections. And among those people that we have been tracing, we are seeing a reduction of those with untraceable source infections. And in early March, we had about 58 cases who had untraceable source infections, which was about 70% of the entire cases. However, this is decreasing significantly to about 5 daily, which account for 5% of the on-day increase. And thanks to the practice of enhanced social distancing campaigns, we have been able to manage the contact tracings as well as their source of infections. And we are also witnessing a decrease in the number of large-scale cluster infections. And during the past 11 years before we conducted the enhanced social distancing campaign, there were 13 cases of widespread cluster infections, but this decreased by over 70% throughout the past 2 weeks as we enhanced our social distancing campaigns. And this was possible thanks to the efforts by the religious circles, by not having physical gatherings, as well as the indoor sports facilities and other indoor facilities have been closed thanks to the social distancing measures. And we need to extend our deepest gratitude to all of the public for your continued participation. However, we know that our public are feeling lethargic and tired from the enhanced social distancing measures, and these are being eased to a certain extent. And by tracing the mobility of our public, we have seen that more people are on the move during the past weekend. And with our mobile phone data tracing, we can also witness that our movement of people has decreased by about 40% after the first cluster outbreak of the Shincheonji case in late February. However, this increased about by 16% during the past weekend. And also the data from the subway data from the Seoul metropolitan city also shows the same results. This shows that we are seeing more people on the move, and if we were able to practice more further social distancing, we believe that we could have managed the situation even better. And despite the past 2 weeks of enhanced social distancing measures, we cannot let our guards down as of yet, because we still have high risks of the virus being more infectious. And we are still witnessing cases in the metropolitan area as well as in Daegu region as well. And we are seeing more imported cases and cluster infections. And above all, we are seeing more than 1 million cases globally. And the number of the fatalities also amount to 50,000 globally. So we believe that the situations abroad is very severe right now. And this is why the government has put on a stronger infectious disease control measures to all of the arrivals from overseas. However, we believe that the next 2 weeks is even more important. Even though we are ending our enhanced social distancing measures, we are seeing a steady increase of the on-day cases by 100 daily. And about 5 to 7% of them are untraceable source infections that are on the outside of our the supervision of the quarantine authorities. And we believe these could pose higher risks of cluster infections. And many of the experts also share the same view. Many experts say that if we ease our social distancing measures, all of our efforts that have been put forth by our public could be in vain. And they also warn that we could be similar to the cases of other countries nationwide. Therefore, the government has decided to extend the enhanced social distancing measures for the next 2 weeks. And we believe that with this effort, we can decrease effectively the number of newly confirmed cases. With this, our objective is very clear. We would like to have more control of the infections, and we would like to manage the situation in a better way. And considering the fact of the capacity, the medical capacity, if we see a steady decrease in the number of confirmed cases, we can treat better those with more severe symptoms. And if we have less than 5% of untraceable source infections, we will be able to have the situation under better control. And as for those newly infections that are beyond the supervision of the quarantine authorities, we believe that these can lead to more widespread infections and become a next Shincheonji case here in Korea. And we believe that we need to decrease the number of people who are being treated now by about 50%. Throughout the past with the next 2 weeks of a social distancing campaign, we believe that we can have the situation under better control. And we understand that many of our public are feeling lethargic and tired from the situation. However, if we ease our social distancing measures, we believe that all of our efforts from the public and the government could be diminished. And we believe that if we are delayed in preparing for the control of the situation, we believe that we will be delayed in the process of going and shifting to the everyday life quarantine. And we believe and we ask for your participation going forward, especially for the next 2 weeks. During the next 2 weeks, we will also monitor the situations of the churches as well as multi-use facilities, including sports facilities and nightlife venues. We ask you to stay on closure, and if you need to be opened, please comply with the guidelines put forth by the quarantine authorities. The government will also continue its crackdown on the violations at these facilities. And the quarantine authorities will also enhance our quarantine measures for high-risk facilities, including nursing hospitals and other hospitals. We will also monitor on a daily basis whether they have anyone with symptoms, and they will be reported on a daily basis. And if they have anyone who have symptoms, we will continue with the screenings of the testings as well as the testings of every one of them within that facility to effectively curb the further spread of the virus. Moreover, we need to curb and we need to manage the situation so that we have no imported cases from overseas. We will have a has integrated system where we could monitor and control those who are on breach of the self-quarantine measures. And for those who breach the self-quarantine regulations, they will be not tolerated by the government, and they will also be penalized if their failure leads to further infections. And we will also have a deportation for foreign nationalities, and we will have an entry ban. We ask for the public's support and participation in the continued social distancing measures. We believe that the social distancing measure is the best choice that we have in order to curb the further outbreak. And this is not only the case here in Korea, but also implied across the world. And this is a measure that we need to partake in for the sake of myself and our family as well as our neighbors. And aside from the visits to grocery stores to buy essentials and hospital visits, we ask you to refrain from going outdoors as much as possible. If possible, please cancel your outings or your travels. And if you feel sick and show symptoms of fever and other respiratory symptoms, please stay home for the next 3 to 4 weeks and monitor your conditions. Please wash your hands and disinfect your neighborhoods, and please ventilate your homes on a regular basis. And since the outbreak of the coronavirus in late December, the world is learning more about the COVID-19 virus. Right now, globally, many medical experts and governments have found that our battle against COVID-19 could be a long-term. And this prolonged battle cannot be diminished in a very short term, and people also expect that this could be years of battling. And we are on a long-term struggle of war between the coronavirus, and just like other countries, we did not have extreme lockdowns, but we were able to manage the situation as we are doing now, thanks to the support and participation by the public in our social distancing measures, as well as the dedication put forth by our medical staff. And in order to claim victory in our tug of war, we believe that we need to be united. And even at this very moment, when we are collaborating as a whole, we need to stay united, and we can soon prepare for the everyday life quarantine, and we could also be relaxed from this long battle against the COVID-19. And in order to claim victory for the next 2 weeks, we ask for your continued participation. Thank you very much.
There you have it. Just a wrap up from the briefing. South Korea has confirmed 94 new cases on Saturday. That brings the total number of confirmed cases at 10,156. With 3 additional deaths, the death toll has now reached 177. Over 6,300 people have fully recovered and been sent home. We have another briefing coming up later at 2 p.m. Korea time. We'll again be providing a live coverage of that session to make sure you're fully up to date with the situation. Bye for now.
Hi, my name is Bruno Bruni. I'm Italian by nationality.